So, all right, welcome everybody. I am so glad to have with us today Debbie Duran. And Debbie Duran is a billing professional that specifically works with mental health clinicians. She also provides consulting. She also helps people get paneled on insurance policies, which is getting credentialed with them. So Debbie has been practicing or providing billing services for over 28 years. And how she got started is really interesting. And also, I sought out Debbie because of her expertise in billing specifically for telemental health. So Debbie, I'm very glad to have you here, and I know that all the listeners and those that will watch this interview will be very really helped by that. So yeah, if you could start off just by sharing briefly how you got started in billing and why is it that you did it?
Okay, I was working at Exxon as an accountant for 14 years, and I was married to a mental health therapist who was PhD licensure, and he kept hiring people to do his billing. And I suppose when it's not your business, these young kids that come in, they don't really take the interest that you would take if it's your business. So he had about $15,000 worth of claims that were just out there. They were mailed to the wrong places. It wasn't that they weren't authorized. They were just there. And he went through 2 people and they just wouldn't follow up. So he said, you know what? It's time for you to quit your job and learn how to do this and to take classes, whatever it takes. This is our income and this can't continue to happen. So that's what I did.
Yeah, so, that's great. That's a perfect fit. And so you and your husband work well together then?
Yes. In fact, I went into the office. I became his office manager, his biller, his everything.
Oh, okay, great. Yeah, now you get all that time together too, which helps a lot. So I know that happens a lot with clinicians, and because of the hassle with having to follow up with things and making sure that you're doing it right, and it's such a hassle that some clinicians say, "I'm just not taking insurance," and then sometimes they'll come back around and get paneled again because they want to be able to take on clients who only want to pay by insurance. So in terms of getting credentialed with insurance policies, in regards to telemental health, I know some clinicians are specifically getting referrals for telehealth because they've kind of been designated as a telehealth provider somehow. With the insurance provider. If you can share some tips about getting credentialed, getting paneled, and kind of how do you inquire or find out whether or not there is this special list or approval for telehealth services?
Sure. Okay. The first thing that you want to do is you want to go to the insurance company website, and under search, you want to type in Join Our Network. Okay, so there you'll find the application, you'll find the entire process, and you'll also find out who the network manager is for your area. If it's not there, you need to use the contact phone number and call and ask, who is my network manager? Because that is your key to everything. If things get lost in the system, they are the ones that are ultimately responsible for your service area. Usually there's a list that tells you all of the qualifications. One thing that will not work, if you use DocuSign or something like that, you cannot electronically sign contracts with them unless they have sent it to you to DocuSign. You cannot, say if you have a biller, they cannot fill out the application and then send it to you and then have you DocuSign it. It'll get rejected.
I see, okay.
It must be a real signature. Now you can email it in or fax it in, it can be a copy, but it has to be a real signature. I found that out the hard way.
Yeah.
Now people like Aetna, the Aetna Behavioral Health, Aetna Better Health, they will DocuSign, they will send it to you and you can electronically sign. I think Cigna's the same and United Healthcare is the same. So if they send it to you, you're good.
Okay.
Another thing that you need to absolutely make sure, oh, God bless you, but you need to be sure of is every single thing that is listed for the attachments, you must attach it. One thing that Blue Cross Blue Shield requires is that the letter that the IRS sent to you when you got your tax ID, they send it by email, you must attach that.
Uh-huh.
Okay, that's really big. They will reject it. And then also when you send in resumes, by every entry, you must have a month and year. By every entry. That is really important. You can't just put the month. You can't just put the year.
Okay.
You must have month/year by every school you went to, every job you had, everything. Those are like really critical.
Mm-hmm. Oh, okay.
Yeah, once you do all of that, then you send it to wherever they tell you to send it. And most insurance companies take anywhere from 60 to 90 days to get credentialed.
Oh, okay. Yeah, you don't want to be rejected for something small like that and have to start
Right,
over.
and if you have one thing that's wrong, your begin date for the credentialing starts all over again. It's that amount of days from the date they receive a corrected, complete application.
Yeah. And you're in Louisiana. Do you do billing for other states or just Louisiana?
I do it for Texas. Right now, Texas is the only one that's outside of my state.
Okay, Louisiana and Texas. Okay. Like I know here in New York State and in a lot of other states, insurance panels have reached out to people asking if they'll do telehealth, telemental health, and asked if they've had any training. Sometimes they want people to have a certain amount of training.
Correct.
And get kind of credentialed as a telehealth provider because they want to make sure the clinicians are competent in providing telemental health.
Right. One of those is United Healthcare Community Plan. I know the Medicaid companies, they want you to sign an attestation stating that you've had training and that you provide it, and then you become credentialed as a telemental health provider.
Okay. So you would just, I guess you would ask your local, what did you call it? The local
network administrator is what they're actually called.
Okay, was it that you would contact them and find out if that's available?
They will know everything that you need to know for your area, all of the requirements. You need to ask them, is there certain criteria that's required in order to do telemental health services, and do you need to be especially credentialed with them for that service?
I see. Okay. Yeah. And some people that provide telehealth services, they don't have a physical location where they see clients.
Right.
So they'll use their home office. And I come across quite a few clinicians that don't want to provide their home office address.
Right.
So they'll use it for billing purposes and so forth. And, some will get a office location just to receive mail. That's all.
Or a P.O. box.
Or a P.O. box, yep. And then some post box office places have it so that it looks like an actual address rather than P.O. box. So do you have any suggestions about that, recommendations in terms of, and then also a lot of clinicians that provide telehealth, they'll be licensed in multiple states.
Yes.
But they won't have a physical address in those states. So are you familiar with how do people handle that in terms of providing a address to get credentialed?
For the telemental health provider that I bill for, he does have an office, but what he does, and I think it's a great idea, is for the services, first of all, he has them give him a credit card to keep on file in case they don't show up for the conferences, for the no-shows and things like that. The insurance will not pay for that, but the client is responsible. What he does is he uses an app called squareup.com. You can use PayPal. You can use things like that and send them a bill that way through their email, and it will just have your name on it and not your whole address. And then they can go ahead and pay for their session by credit card if they want to, directly on there, and then no address for the provider is shown.
Sure, but what I mean is getting credentialed with insurance.
Oh, credentialed.
Yeah, not billing the client. And in terms of billing the client, I recommend that they never send an invoice through email to clients. But in terms of getting credentialed with insurance providers,
what I've run across is, on all of the applications, there's going to be a spot that says, do you provide services from your home? Okay. Most of them will not approve you if you're doing it from your home, or they will have to do a home visit. because you have to make sure that there is no one else in the house that's going to have contact because of confidentiality. You have to be sure that you have a bathroom that is right next to the office so that they don't have to wander through your home because of liability. It's a lot harder to get credentialed if you have an in-home office. Blue Cross will not even consider it at all.
Oh, okay.
Have an in-home office.
Yeah, because with telehealth, of course, the clients are not coming to the home office.
Right. But what they're expecting you to do is to have an office location, and then you do the telemental health from your office, and then the patient is at home.
Sure. Okay. But you would still have to provide that business address, right?
Yes.
So what if you don't have an address within that state? So you say, well, say I'm licensed to provide services in California, but I live on the other side of the country. I don't have an office in California.
Oh, that part I don't know. As long as you are in the location that you are licensed to do counseling from, you should be okay. Now you can go.
I'm not referring to
telemental health from that location if you're licensed in Louisiana.
Yeah, and I'm not referring to being able to legally practice. I'm just referring to getting paneled with the insurance company. So say I wanted to get paneled with Blue Cross in California.
Well, they're going to ask you if you have a license for California.
Sure. Yeah, and I have a license in California.
Oh, well, then you're fine.
But what I'm referring to is the address that I provide, the business address when I go to get paneled with them. Do I need to have a physical address in California?
No, you don't have to have one in California. You just have to be licensed to practice in that state.
Okay. All right. Yeah. All right. That helps a lot. And I know a lot of states have telehealth parity laws requiring, and they vary greatly state to state what the telehealth parity laws cover and don't cover. Sometimes insurance companies won't reimburse for telemental health services, even though there is a telehealth parity law that requires it. Somehow they find ways around it, or it's just simply not being enforced. Mm-hmm. And sometimes when people call to check benefits, the person that they speak to on the other end of the line with the insurance company is not aware of the 95.
Oh, I lost you.
Oh,
there you are.
There I am. Yeah, so sometimes the insurance companies are just not, the people they talk to at the insurance companies are not aware of the benefits for telemental health services. Do you have any recommendations in terms of how people handle that?
What you need to do when you call to request benefit information, you need to always start out by saying, I am calling to request benefits for telemental health services. The place of service code is 02. And it is for, and then you would say an LPC, a LCSW. So you always need to let them know the place of service code, because most of them don't even know what telemental health is, but they will look it up on their computer, and when they type in the code 02, it's going to let them know that it's mental health, that it's telemental health, and they can look it up that way.
Okay.
I've never had a problem with doing that. And then, but also when you do that, I have a list of questions. I have it written down that I always ask. I say, can you please confirm my network status? That's number one, because you might not realize that you may not be credentialed for telemental health, but you are for just regular outpatient office visits. So you need to ask them, is there a criteria? You need to say, does the client have out-of-network benefits? Because sometimes they're not in network, but they have out-of-network benefits, and sometimes the copay is even the same. Most of the time it's a high deductible, or they may have met their deductible. So you always need to ask that question. Is telehealth a covered benefit? You need to ask, is it for their particular policy? Mm-hmm. Because you may have one patient that it is and one that it's not, and it depends on what plan their employer set them up with. Let's see, what specific payer ID should the claims be routed to? That is more important than anything, because it doesn't matter what you write for an address. If you're filing electronically, it's only going to pull the payer ID. And that's what sends it to where it needs to go. Let's see. Which CPT
So the
code?
payer ID might be different because of telehealth?
No, it won't be different because of telehealth, but a lot of times, you might type in the correct claims address, but you don't have the right payer ID because there may be 6 or 7 different type plans for that one insurance company. So you need to say, what payer ID do I use for these claims?
Okay.
It's not, even if you have the correct address, it's not going to go there. It's going to go strictly by the payer ID. That's how it routes through the clearinghouse.
Okay.
So the payer ID is more important than the address. Believe it or not. Now, if you're filing a HICFA, a paper claim, of course, you have to have the correct address because that's done through snail mail, and there's nothing, no clearinghouse to go through. Does that make sense?
Yeah. The payer ID, that's the so the insurance company will have multiple kind of sub companies.
They can.
Right. And you want to make sure that it's going to the correct payer.
A good example of that would be Optum, because they have Optum Medical and they have Optum Behavioral Health. So if you look up Optum and you use the Optum Medical, there are a lot of times they will not forward them to the correct department. They need to go where they need to go. So the you have like dental, you have medical, and you have behavioral health. It's like 3 different kinds of plans that are totally unrelated.
Yeah. Okay.
So, in fact, all of the claims for my ex-husband that didn't get paid is because they went to the medical plan instead of the behavioral. So that's really important to make sure that you hit the behavioral. A lot of insurance companies carve out their mental health or behavioral health to other companies.
Mm-hmm.
So
sure. Yeah. Okay.
That's really important to know what payer ID for that patient's policy for telemental health do you need to use.
Sure. Yeah. Anything
and then
else?
you need to ask them, what modifiers do you use? Because there's actually more than one modifier for telemental health.
Sure. Yeah. Some people use the 95. Some people use the GT.
Medicaid and Medicare basically use GT.
Right.
With the O2 place of service.
Sure. Yep. Yeah. And O2 place of service is generic, meaning telehealth.
Telehealth.
But GT and 95, they mean video conferencing.
Correct.
Yeah. And I know clinicians who've really gotten into hot water. They've lost their practices. They lost their homes because they had paid a lot of money because they were billing the regular billing code when providing phone sessions.
Yes, you can go to jail for not using the correct place of service. That's fraud.
Yeah, and the modifier, right? So like if they're doing phone sessions, you don't bill 95 modifier, right? Or GT modifier, or email or texting, right?
Actually, most of the insurance plans will not. Well, say if you're on the phone, if you're doing a mental health session, and then you lose connection, and then you say, well, let's just pick up the phone. Right. Well, most of the time, the phone calls are not covered. They are not considered telemental health. It has video. So you have to look. There's certain codes, like the assessment is not supposed to be done for telemental health. That is not 90791 is an initial assessment. That is not a telemental health CPT code. There's a list of certain ones like the 90837, which is 60 minutes. You can do it with all of those. So you have to look at the code and how many minutes that code allows for. Now, it's perfectly okay to say, I'm going to use 10 minutes to do my notes. So you go 10 minutes under and it'll be okay. But if it is a 45-minute code and you were only talking to them 10 minutes and you got disconnected, the best thing to do is to call them and say, let's reschedule. After you keep trying and you can't successfully connect, it's better to reschedule for the next day or something else and keep it all telemental health, and then you will get paid.
Yeah, that makes sense. That makes sense.
You have that availability, of course.
And when you call to check benefits, I've been told to request or ask for the now I'm going blank on it. Provider relations. There you go.
Yes.
The provider relations person.
Well, in provider, you will find the network provider manager in network.
Okay, so
Relations.
you should definitely call the provider manager in your area then.
Yes.
Not just a general number for the insurance company.
Right. Yeah, you need to have your own representative. When I do deal with any issues with claims, with not just regular benefits, but if it's something specific that I wanted to know at one point was CPST and PSR, which is home visits. What, could those clinicians, because a lot of them are not licensed, their behavior, they're just bachelor's level, could they do it? Well, I wouldn't call claims. They don't really know. I wouldn't call benefits. They are not really going to know. So I call my network representative, because she will go to the appropriate level and they'll look at the contracts and they'll let you know for sure.
Okay, yeah, that makes sense. That makes sense.
They are your representative. They are there for anything, that is unusual, any problems that arise. You don't want to just deal. Now, if you have a claims issue, of course, you're going to talk to the claims department. But if you have a whole lot of claims that are denying and they're not your fault, your provider rep.
Sure. Okay. Yeah. And in some states, in regards to Medicaid, you have to, again, attest to a bunch of criteria that you're using certain equipment,
Absolutely.
processes,
laws.
Yeah. So if you're billing Medicaid, I guess you need to find out, again, whether or not you are paneled for that, for telehealth.
Correct.
Right. Yeah.
Or if being paneled specifically is required.
Okay. Yep. And if there's any specific requirements, but with private insurance, it seems pretty straightforward. They either cover the service or they don't. Right. But some insurance companies, like you mentioned, United Healthcare and I know many others do want people or require people to get credentialed for telemental health.
Yes.
Yeah. Is there anything else that people should consider when billing for telemental health services?
That is mainly it. Those are the main components that have to be met.
Sure. Now, I know some people have received phone calls from insurance companies requesting that they provide phone counseling sessions. So typically, usually that is not covered, right? It's not reimbursed.
Right. It's not reimbursed as telemental health.
What's that?
It's not reimbursed as telemental health.
Okay.
Now, for phone sessions, that is usually done by a medical doctor or a nurse practitioner or a psychiatric mental health practitioner. It's not usually approved for LPCs or LCSWs. You have to be a medical doctor.
Okay. Yeah. Hopefully that will change in the near future, but not yet. Unless they've gotten specific approval, because I suppose some clients have had reasons of needing it, and that's why clinicians have gotten calls from insurance companies requesting that, but it's been on a case-by-case approval type.
If that happened, I would most definitely request that they do a specific authorization with a time frame and a number of times that you can do it in writing and give that to you, because they might want it, but claims may not know anything about it.
Oh, okay.
So yeah, get everything in writing.
Right. Good point. Yeah. And so what's the differences between a clinician going through a clearinghouse themselves versus using a professional biller such as yourself?
Well, one thing, a professional biller has been through a lot and seen a lot, and they know all the ins and outs and what the insurance companies are looking for. Usually, I don't know about all billers, but I always verify benefits for every patient before I see them. I check their eligibility, what their copays are, their deductibles. I call the patient and let them know what it's going to cost them before they get there. So that they don't get there, or telemental health, if you do the session and then they didn't know their copay was going to be $50 and they say, oh, well, I can't afford that. Well, a professional biller generally will make sure that patient knows what it's going to be, and it's only fair. before they do that session. That is one of my really, really big things.
So it's not just the getting paid. It's it's also
I lost the volume.
yeah.
There you are.
It's not just about getting paid. It's
Right.
also about customer service and
Absolutely,
ethics.
yes.
I like that you point that out, because you're providing very good customer service. It's full disclosure. They know ahead of time what they're going to pay.
And also, if you're using a sliding fee scale, I have found that every counselor that uses one, they don't want to talk about that with the patient. They don't like talking about money. They feel like they're there to do the counseling. It's a thing from their heart. They're there to work with them. They don't want to have to negotiate what it's going to cost. Well, that's the biller's responsibility.
That's great that you point that out, because the clinician's really in a dual relationship in that aspect.
Exactly.
Because you're a collections person, right? You're collecting money from them,
right?
And you're also their clinician. So it's really a dual relationship, and it's helpful not to be in a dual relationship.
I haven't found one that likes it yet.
Yeah. So I like that you point that out, that, hey, the billers does collections.
Yes.
You provide the clinical
I have never
service.
had one that ever wanted to do that negotiating. And,
Yeah.
a sliding fee scale, it's not something that you pick and choose. It depends on how many are in the household, what their income level is. So it's not like you're saying, and there's another thing too that's a very good point about billing. If you think that you can charge a smaller amount for a private pay client than for an insurance client as far as your fee, you cannot do that. That is completely incorrect. If you feel like you have a client that really can't afford the copay, there's a way around it that is completely legal, and that the billing classes have always taught us, to explain to therapists, it's kind of funny the way it works. Okay, you can do what is called a prompt pay discount, which means they pay their copay quickly. Now, an insurance company can't pay you immediately, because it has to go through the clearinghouse, which takes 24 hours. Then they are allowed, if you file electronically, they're allowed 2 weeks, to process your claims and get payment. If it's a paper claim, then it's 30 days. Well, they can't meet that guideline, so they cannot get charged that reduced fee. The other term that you can use, say if somebody's house burned down, or if they've had a severe tragedy and you want to give them a lower rate, then it's a charitable discount.
Okay.
Those are the only two terms that you should ever have for discounting a service. You have to charge the insurance companies the same basic rate as you do private pay. That is a very huge thing. If
sometimes
companies find out that you're charging less to your private pay, they will cancel your contract.
And sometimes clinicians, they'll get paneled, but then decide, I'm not going to take that insurance because they don't pay enough. So even though they remain paneled, and they might take that insurance once in a while,
right.
When clients call and say, hey, I have so-and-so, I have this insurance, the clinician might say, well, I'm not taking insurance, because they don't feel like it. They don't want to.
That's not the correct, appropriate protocol. What they should be saying is, they don't have to tell them what their numbers are, but they should decide for their office. Okay, for Beacon Health, I want to have a total no more than 4 clients. For Medicaid, I want to have no more than 25 clients. So they can stay within that range. As long as they do it across the board, they can do that and and when the patient calls and says, oh, I have, such and such insurance, and you don't want to take it, the correct thing to tell them would be, I have a full caseload for that insurance company. If you'd like to call back in a month or 2, that's your option. But right now I have a full caseload for that insurance company. And it's okay to say that.
Okay. Yeah. Yeah, that's great. So so as a billing professional, you help keep clinicians out of hot water.
I do their complete practice management. I am not just a biller or credential. I do their complete management.
Yeah, help keep them legal.
That's the consulting. You know, if I do their billing, they're going to get the consulting because I don't want them to mess up, and I don't want more work for me.
Right. Yeah. Do you do consulting outside those states of Louisiana and Texas?
I haven't really. I've pretty much stuck to Louisiana because just from word of mouth, I've gotten so many clinicians that I pretty much, you know, I stay busy with Louisiana. I did have somebody from Texas. In fact, it's funny. It's a billing company that I'm doing consulting for because he does medical.
Oh, okay.
And I'm doing training. Right now I'm working on training videos and things like that so that he can use to present to them to teach them how to do their practice. So that's pretty much what I'm doing for Texas.
I see. Okay. And how should one go about selecting a professional biller? What should they look for?
One thing that I do, I know a lot of billers don't, is I don't charge a provider until they have the money in their hands. And the reason that I do that is because I think it encourages me to stay on top of the claims, to pay attention to what I'm doing. If I bill a claim and it's denied, I get nothing. I have verified benefits for that patient. I have gone through the whole process, but if I don't do my job and do my research and make sure I'm billing correctly, I'm not going to see any money. And it's only fair to the therapist. Why should they pay me because I submitted that claim if I didn't do it correctly or I didn't make sure there was authorization? You know, I didn't follow all of the steps that need to be done. A lot of billers, it's just, you know, a certain amount every month, or it's, you know, a certain amount per claim. I do it based on, you know, when you get the money in your hand, then you will get a bill for a percentage of your income. So I think that's fair.
Yeah, that definitely makes sense. Yep. And of course, they need the business associate agreement if they're a covered entity under HIPAA law.
Yes.
Are there any other things that they should look for in terms of, you know, how to vet out a biller to make sure that they're ethical, that things are going to work smoothly, that it's not going to be too much of a hassle on the clinician's end?
Well, I think if you can get a biller that will verify benefits for you as well, it's going to save you a lot of headache. If they're willing to speak to the patients for you, that's something that I do is I will speak on behalf of the provider for any issue, if that's what they request, but everyone has always. They're like, yeah, please talk to them. Yeah. You know, if they're knowledgeable, how long they've been billing, because they need to know what is billable for certain companies, what is not, and you really pretty much learn that through experience. You know, find out that this is not going to fly, that's not going to fly. They need to know that you have, you know, if a patient has moved and the insurance company still has their old address, but they're providing you with the new, well, if you go online and you check their benefits, you're always going to see the address that the insurance has. You need to bill with what the insurance has and then notify the patient, we have to keep it this way until you update it with your insurance. That's how you get denied claims if you don't do that. But then you always have to put a note in there that says this is the correct address in case you have to send them a bill. That's our communication.
And what do you find to be like an efficient process in working with the biller? So say I'm a clinician, I get a call from a prospective client. They end up scheduling a session. You know, at what point do they bring the professional biller in to check benefits and to get back with the client? Okay,
I generally don't do scheduling because it gets too complicated. I've tried it, and then they want days off and they forgot to put it on their scheduler, and, you know, and they may have an emergency. So that's, you know, I will reschedule for them if they request it, but I won't do the initial scheduling. But when they get that phone call, they have a real short form of information that I have to have. And it would be the patient's name, date of birth, their insurance company and the insurance company's phone number, although I have most of them, who the policyholder is, and the policyholder's date of birth. They have to provide, and the patient's phone number. They provide that to me so that I can go ahead and check all of the benefits, let them, and then I let the provider know, okay, this is what the benefits are, You know, their copay is 20, or they have a deductible, and this is how much has been met. They have this much further to go. So that's what starts the process, is when they get the phone call, they put them on the scheduler, and then they forward that information to me. Then I call the patient and I tell them, let me explain your benefits. Most patients do not understand mental health benefits. They don't understand policies. So I take the time to tell them, this is what this means. You're going to have to pay $115 on the first visit, and then $98 for the next 3, and then your deductible will be met. And then it's only going to be a $25 copay, and you can go, twice a week. So that, that's how that works for us.
Yeah. So they get the call, they schedule the client, they get the information, they provide it to you, and they let the person know. They say that, I'm going to be providing your information, insurance information, to my biller,
and she'll be calling you.
They'll be calling you to notify you of your benefits.
Right. And then also, when I go into the software, I type in, in a certain block, all of the benefit information, so that when the provider, logs in, he can see all of that too, in case he's in a session and they say, I don't remember what she told me.
Okay,
it's
great.
right there, and he can read it and say, well, this is what she told you, and you have a deductible of $500 and you've only met $200, and so if it's 1 through whatever will be this much. So that's another service that I do, and it makes it, I like the therapist to be there to do counseling.
Right. Okay. And then if there's a billing concern, you just notify the clinician.
Right. Yeah, they do not speak to him about any billing concerns at all.
Right. And then the denials go to you, and then you handle the denials.
Right. I do any adjudication of claims, corrected claims, which is very few, but if there ever is one, I do all of that. The therapist generally doesn't even know that that's happening. If he wants to know, he's provided with a report every month. He's also provided with a report that tells him, this is what was billed this week, and this is how much you should be receiving from Blue Cross. This is how much you should be receiving from AmeriHealth Caritas, so that they can actually see what they should be looking for.
I see.
And then if those claims were billed and it doesn't come in, well, then that's me calling the insurance company to say, this is an outstanding claim. It's been over 2 weeks. What is the status? Is there a problem? And we need to get it expedited.
Okay. Yeah, that's very, very helpful. I thank you very much, Debbie.
Okay.
And for any of you that are in Louisiana or Texas, right? I love Louisiana. My wife's family is in Louisiana. My wife's from Louisiana, right near New Orleans. So I love Louisiana.
Wow. I'm not far. I'm 45 minutes from New Orleans.
Oh, neat. Yes, I'll be presenting there.
Oh, really?
Annual conference, the Counseling Association's annual conference this year, 2000.
The LCA?
Yep, the LCA conference.
They begged me to teach there a few years back, and I just couldn't make the time.
Oh, okay.
They wanted to know how to deal with insurance companies, because that is not in school.
Right, yeah, you don't learn that in school. Yeah, so I'll be doing a pre-conference, a full-day training on telemental health there, because in Louisiana, they're required to get at least 9 hours of training in telemental health.
Yes.
So if any of you are in Louisiana or Texas and you want billing help that's going to be professional, efficient, effective, and make your life easier and provide better customer service to your clients and also keep you out of hot water, contact.
I also do mental health rehab, which is a really big deal.
Okay.
Yes, I do. I am working for 2 mental health rehab agencies right now.
And they do a lot of telehealth now. There's a lot of telehealth grants for substance abuse.
Yes.
Yeah, especially opioid addiction. So, okay, that's great to know. So you can contact Mental Health Billing and Consulting, which is Debbie Duran's company. And her phone number is 985-415-9841. That is 985-415-9841. And her details of how to contact her with her email address and phone number will certainly be in the detailed portion of this video. So thank you very much.
Thank
And
you. It's
Debbie,
been great.
yeah, it's been a real pleasure. I really enjoyed it. It was very, very helpful. Thank you.
All right. Goodbye.